We use it daily. We perform oral surgery, implant surgery, oral and maxillofacial surgery. The patients who come to us all have a dentist. They are also likely to have visited their dentist surgeon. They then might have tried somewhere else and finally ended up seeking help, searching nationwide. Our patients come not only from Germany, but from all corners of the globe. I have been using the material myself for 16 years. A former boss of mine first introduced me to it. A far cry from the quality that we see today. It was still in its simple original form back then. CERASORB has the following major advantage. It does not contain animal or human tissue or cells. It is a pure and safe product that comes straight from the laboratory. There's no chance of suffering a prion reaction due to animal cells. The product cannot be rejected either because it does not contain any protein antenna. This means the material is very safe and uncomplicated for patients, and we can avoid having to take bone grafts from the lilac crest or from the skull cap. It was very controversial. Not only was it heavily criticized by university clinics and large hospitals, but it was also rejected and attacked. The early years required lots of development work. I gave hundreds of lectures, published countless patient cases, and performed thousands of operations before the idea of using artificial material produced in the laboratory found acceptance nationwide. The advantages are plain to see. There's no risk of rejection, and it is easy to use, no pain for patients, and unlimited availability. For the doctor who does not have to repair jaw or bone defects too often, it goes like this. No harm in having 2 to 3 bottles of CERASORB in the drawer. Casually speaking, the material lasts for 5 years. There will come a time, no doubt, after a few months, even after a year maybe, when he has to treat a defect, whether it be a wisdom tooth or a small cyst, at which point he'll say, "Man, look at that cavity. I wouldn't like to leave it like that. I know, I'll use CERASORB." He may have some minor struggles to begin with. How do I get CERASORB in there? How much blood should there be? How much pressure do I apply? How do I position this? How do I cover that? Well, that is quite normal. There are plenty of experienced colleagues available to lend a hand. We offer workshops. We provide support from colleague to colleague. I myself offer everything from hands-on training to specialist medical training in my clinic. This means it is pretty simple to acquire the knowledge and then put it into practice. It is not without risk, however. Nothing in medicine is without risk, but it is extremely low risk. It is great for patients because they can have their bone defect fixed without any pain. And as a doctor, this material poses very few problems.